So I'm a child and adolescent psychiatry fellow, and what I do is treat kids with mental health disorders. One of my particular areas of focus is working with kids with developmental disorders and autism spectrum disorder.
So as director of point-of-care ultrasound, my job is to work with other attendings and residents from pretty much all the services, teach them how to use bedside ultrasound to better take care of patients, reduce complications, and just figure out how they can use this new technology in their practice. So I'm also the Assistant Emergency Medicine Program Director, so I'm responsible for helping train the emergency medicine residents.
My husband and I are very different. He's a brilliant man, but he didn't spend a lot of time studying in medical school, whereas I was perhaps a little bit more diligent in my studies and would be at the library, W.T. Young Library, all the time. And all of a sudden, Matt just started showing up at the library.
When I say we met, I guess probably a better description would be that I stalked her into the library. She was very focused.
He just never left, and neither did I.
And it eventually paid off, and I think you can only pretend to study so long before you're actually studying, so she had a very positive influence on my grades as well.
We dated for about a year. We're engaged for a year, and then we got married between our third and fourth year of medical school.
After we got married, we went away for our training to the University of Utah, and then we loved the mountains, we loved it out there, but at the same time Lexington is a beautiful place, wonderful people, all our family is here, and so we're back here now with a 4-year-old and a 2-year-old.
UK, it's sort of like, additional part of our family. I mean, I met my husband in medical school at the University of Kentucky. Later on, my daughter was treated at the University of Kentucky for her own health issues. So, I think that I'm particularly connected to it because of my family life.
When Avery was sick, that's every parent's worst nightmare, have their child. She was very sick in the pediatric ICU.
She was ventilated for 6 days before we knew exactly what was wrong with her.
And being on the other side, I think, was much more difficult than I ever imagined it would be.
It was, of course, an incredibly scary and difficult time for our family.
It was very comforting knowing the physicians that were taking care of her in many instances and seeing the great care she received.
She was eventually diagnosed with infant botulism and has a wonderful prognosis, and she's feisty and curious and talking up a storm now, and she's like any other 2.5-year-old.
Now she's 2.5 and she's perfect. So we're very thankful, as we were before for UK giving us medical training. It's taken to a whole new level now after what the medical providers here did for our daughter.
What I'm going to try and do is continue to keep the patient in mind and the patient's experience central to what I do in treating them. So it's not enough to know about medications and therapies when I treat kids. I want to take the family's perspective into account because, again, I was on the other side of receiving treatment here.
I think we both feel like we owe a great debt of gratitude to UK for training us, for giving us our medical training and enabling us to take care of patients, which is has been our goal for a long time. And I think we also feel very lucky to be able to serve the state now. We're both from Kentucky, and I think it's a very rewarding thing for us to think that UK trained us and now we're back delivering care to the patients from where we're from.
So I think a lot of good has come out of what happened with Avery. I wouldn't want to go through it again, but I think we've been able to find ways to make this place even better because of what happened to her. And I think we're still doing that. Actively looking for ways to improve the care that we deliver at UK. Because we're proud of being here.